There are two ways a doctor can declare a person legally dead. The first is cardiopulmonary death. It's when the heart stops beating and the lungs stop working. After cardiopulmonary death, the body's cells start to break down due to lack of oxygen. This is the very beginning of the decomposition process. Cardiopulmonary death has pretty much always been the best way to declare someone as absolutely dead, or what the medical establishment calls permanently and irrevocably dead. But about 50 years ago, a group of Harvard doctors, led by this guy, came up with a second definition for death. They said a person could be considered dead if the brain had ceased to function. Brain death was different than a coma or vegetative state, where there are levels of consciousness and brain function. Their reasoning was that the body couldn't function without the brain, and a person without a functioning brain wasn't really a person anymore. They recommended a series of criteria to determine brain death. And in the years since, brain death has become recognized around the world. Everyone agrees that brain death is death, permanent and irrevocable. But not everyone agrees exactly what brain death looks like, when exactly it happens, and how to test for it. Different countries have different laws and rules about brain death, and some brain death laws have been written to allow for exceptions. These marginal differences have created a sort of death limbo where, in very rare cases, a person can be considered legally dead in one place, but alive in another. And one of those places where they can be considered alive? New Jersey. The line between life and death has never been as cut and dried as we would like to think. Humans have always gone to great lengths to be sure the person they were burying was actually dead. Ancient Roman funerals included mourners shouting the deceased person's name to try to wake them up. During the Renaissance, bodies were poked and prodded, limbs were violently shaken, and horseradish and garlic were stuck up the nose to confirm death. All this was done because death could be deceiving. Mistaken death and premature burial were a legitimate fear from the Middle Ages through the 19th century. Horrifying tales of people waking up underground forced the creation of elaborate alert systems to make sure no one was accidentally buried alive. As medicine advanced, doctors realized the importance of the respiratory and cardiovascular systems, establishing cardiopulmonary failure as the most surefire way to confirm death. But the Harvard doctors came together in 1968 to tackle a problem that had emerged because of medical advancements. The ventilator was a machine that facilitated breathing if the lungs stopped working. If a person with a traumatic brain injury couldn't breathe without a ventilator, how could they be considered alive? The Harvard group proposed a set of criteria for brain death. The criteria were simple and could be tested with these tools. I have a question for you. Are you alive?
Yes.
Can I test it?
Yes.
Okay. Here's how it works. First, conditions that might appear to be brain death, like a drug overdose or hypothermia, must be ruled out. Then, a cotton swab is pressed against the patient's eye to induce blinking. And a rubber hammer is used to check for a pain response. Next, a flashlight is used to check for pupil response. Then cold water is poured into the ears. If the patient is alive, their eyes will shiver back and forth. Doctors also check for a cough and gag reflex and perform an apnea test, where the ventilator is turned off. An alive person would reflexively make an attempt to breathe. A brain-dead person would not. If the patient doesn't respond to any of these tests, they are declared brain dead. That was a perfect one. You're alive.
Great.
This is something doctors want to get right, for obvious reasons, but also because brain-dead patients are ideal organ donors. Brain death only makes up around 1% of deaths, but accounts for 90% of organ donations. Organs have a limited window of time they can be preserved after death, but with a brain-dead person, this window can be extended because the heart and lungs can still function, delaying the cellular breakdown that occurs with cardiopulmonary death. To facilitate this, a brain-dead person is kept on a ventilator after they die, becoming a beating heart cadaver. The original 1968 brain death criteria have been adapted into laws and guidelines around the world, but they don't exist everywhere. And where they do exist, there are slight variations in how the brain death test is carried out. Some countries require the test to only be performed once, by a single physician, Others require 2 physicians to perform the test, with an observation period in between. But that period can vary from a few hours to a full day. Also, confirmatory tests that measure brain activity, such as an EEG, aren't required in many countries. In the United States, 2 physicians are required to conduct the brain death test 6 hours apart before declaring death. But confirmatory tests are optional. In Mexico, a single physician is fine, but they have to wait 24 hours before declaring death and run confirmatory tests. So if a person who was declared dead at hour 6 in the US were wheeled across the border, they'd still be legally alive in Mexico. A person has never been mistakenly declared brain dead and later recovered, but there have been instances of a brain dead person crossing between jurisdictions and becoming legally alive again. New Jersey is the only state in the US that has a religious exemption for brain death. In 2013, 13-year-old Jahai McMath was declared brain dead after a routine tonsil surgery in California. Her family refused the death declaration and had her body transported to New Jersey, where she was kept on a ventilator for 5 more years, until she died, again, of heart failure. McMath was issued 2 death certificates, one in California and the other in New Jersey. Our ideas and definitions about death have evolved over time, and our standards have changed. They can often be cultural or contextual or based on scientific advancement. But one thing hasn't changed. We all are definitely going to die someday, permanently and irrevocably.
Ah, you gonna poke me in the eye?
I think that's the reaction of an alive person. How do you define death? Where do you draw the line? Let us know in the comments below, and like and subscribe for more Cheddar deep dives and breakdowns. And make sure you turn on notifications so you know when we drop new videos. I promise they're not all as macabre as this one.